I'm Kirstine Mackay and I work in the Child Protection Research Centre at the University of Edinburgh, and I'm going to talk a little bit about some recent research we did on formulating foster care in Scotland for young children's emotional and mental well-being, and we specifically looked at children under the age of 5 years. We do know that increasing numbers of children below the age of 5 years are going into care, becoming looked after, and we also know that increasing numbers of children who become looked after are in fact going into foster care. Because the majority of children who go into care have been exposed to abuse or to neglect, this means that they're likely or more susceptible to mental health and emotional problems, and that could be conduct disorders or delays in reaching developmental milestones, or they may be traumatised by things that they've been exposed to prior to coming into care. And so the sort of types of behaviour they may show are things like screaming or head banging, or they may be particularly withdrawn. So for this research project we reviewed the literature to try and find out how extensive these problems are amongst children who enter foster care, and we actually found there's been very little research with this cohort of very young children, and the estimates of the prevalence of emotional and mental health problems amongst this group varied enormously in the research, from as low as 19% to way up to 67%. And the main factor that seemed to influence that was how mental health problems were defined by the researchers, how broadly or how narrowly. However, the research consistently showed that those children coming into foster care, or a higher number of them, had mental health problems compared to children of a similar age who weren't entering foster care. We also interviewed a number of foster carers, and they described quite lucidly different types of behavioural problems they'd encountered looking after this very young cohort of children, and they also described what they did to help these children to recover from the events that had impacted in this way on their behaviour. Things like modelling positive behaviour, providing warm and consistent care, efforts to build an attachment with the child, and efforts to stimulate the child's development. So from our research it was clear that foster carers do have a role to play in helping young children who go into foster care to recover from mental health problems that they may have as a consequence of abuse or neglect. However, we also know that the removal of an infant from their foster carer has the potential to some extent to undermine that recovery, and so next week I'm going to be talking about concurrency planning, which is when a child can be placed with a foster carer who may go on to adopt that child should it be decided that it's not in the best interest of that particular child to be returned to their birth family.